Hello students, welcome on board. This is part 2 of the chapter Reproductive Health, wherein you will be learning about the different sexually transmitted diseases, infertility and assisted reproductive technologies. For better understanding, please do watch part 1. Without further ado, let's begin with the first topic. The first topic is sexually transmitted diseases. These are diseases which are transmitted through sexual intercourse. Sexually transmitted diseases are the diseases which are transmitted through sexual intercourse, and they are also known as venereal diseases or reproductive tract infections. Now, some of the common sexually transmitted diseases are gonorrhea, syphilis, genital warts, trichomoniasis, hepatitis B, HIV leading to AIDS, genital herpes, etc. Now, the diseases like hepatitis B and HIV, though they are sexually transmitted diseases, they can also be transmitted by sharing needles, or surgical instruments with an infected person, by the transfusion of blood, or from an infected mother to the fetus. So hepatitis B and HIV, they can also be transmitted by sharing needles or surgical instruments with an infected person, by the transfusion of blood, or from an infected mother to the fetus. Alright. Now, STDs like gonorrhea, syphilis, genital warts, and trichomoniasis, these are curable diseases. If they are detected early, and treated properly. Whereas hepatitis B, AIDS, and genital herpes, these are incurable diseases. Alright. Now, some of the early symptoms of sexually transmitted diseases are itching, fluid discharge, slight pain and swellings in the genital region. What are the symptoms? Itching, fluid discharge, slight pain and swellings in the genital region. So we've learned about the sexually transmitted diseases. What are sexually transmitted diseases? These are diseases which are transmitted through sexual intercourse, and they are also known as venereal diseases or reproductive tract infections. Alright. Now, the incidence of sexually transmitted diseases are high among the people in the age group of 15 to 24. These diseases can be prevented by avoiding sexual practices with unknown or multiple partners, by using condom during intercourse. In case of any doubt, visit a doctor immediately to get a treatment. Now, in case of some females, the sexually transmitted diseases, they remain asymptomatic for some time, which results in the late detection of these diseases, which can lead to complications like pelvic inflammatory diseases, abortions, stillbirths, ectopic pregnancies, infertility, and even cancer in the reproductive tract. Alright. The next topic is infertility. Infertility is the inability to produce children in spite of unprotected sexual cohabitation. What is infertility? Infertility is the inability to produce children in spite of unprotected sexual cohabitation. And the reasons for infertility can be physical, due to congenital diseases, drugs, immunological, or psychological. Now, there are several infertility clinics which can diagnose and provide treatment to infertile couples to help them have children. But sometimes the corrective treatments may not be successful, and in such cases, assisted reproductive technologies are used. In this video, we'll be learning about 4 such techniques, which are in vitro fertilization, gamete intrafallopian transfer, intracytoplasmic sperms injection, and artificial insemination. First, we'll begin with in vitro fertilization. Now, in vitro fertilization or test tube baby program is a technique in which ova from wife or donor and sperms from husband or donor is collected and induced to form a zygote in the laboratory which provides the same conditions as in body for the fertilization to take place. So what is in vitro fertilization? In vitro fertilization is the procedure in which ova from wife or donor and sperms from husband or donor is collected and induced to form a zygote in the laboratory with same conditions as in the body. Alright. Now once the ova and sperm is induced to form the zygote or early embryo, it has to be transferred into the fallopian tube or uterus for further development. Right. This transfer is called embryo transfer. What is it called? It's called embryo transfer. So embryo transfer is the transfer of early embryo or zygote into the fallopian tube or uterus for further development. And there are two types of embryo transfer. The first one is zygote intrafallopian transfer and the second one is intrauterine transfer. Alright. Now in zygote intrafallopian transfer, as the name suggests, the zygote is transferred into the fallopian tube. Here the embryos with 8 blastomeres is transferred into the fallopian tubes. Alright. In zygote intrafallopian transfer, the embryos with 8 blastomeres is transferred into the fallopian tube. Now in intrauterine transfer, as the name suggests, here the embryo is transferred into the uterus. Now in this case, the embryo of more than 8 blastomeres is transferred into the uterus and it is called intrauterine transfer. So we've learned about in vitro fertilization or the test tube baby program, and how is it done? It is done by collecting the ova from wife or donor and sperms from the husband or donor which is induced to form a zygote in the laboratory with same conditions as in the body. Now, once the zygote is formed, it is transferred into the fallopian tube or uterus for further development, and this transfer is called embryo transfer. We've learned about two types of embryo transfer, which are the zygote intrafallopian transfer and intrauterine transfer. Alright. The next assisted reproductive technology is gamete intrafallopian transfer. In this method, the ovum is collected from a donor and it is transferred into another female who is unable to produce ovum, but can provide suitable conditions for fertilization. So what is gamete intrafallopian transfer? It is the transfer of an ovum collected from a donor female into another female who is unable to produce ovum but can provide suitable conditions for fertilization. Right. The next procedure is intracytoplasmic sperms injection. Now, as the name suggests, the sperms are directly injected into the ovum to form an embryo in the laboratory, which is then later transferred into the female. Alright, so what is intracytoplasmic sperms injection? It is the procedure which is carried out by directly injecting sperm into an ovum to form an embryo within the laboratory, and the embryo transfer is done later on. Alright, now the last assisted reproductive technology is artificial insemination. It is the procedure in which the semen is collected from the husband or a donor and then it is artificially introduced into the vagina or uterus. Now, if the semen is introduced into the uterus, then it is called intrauterine insemination. Alright. Now, artificial insemination is carried out in male partners who are unable to inseminate, the female, or due to their low sperm count in the ejaculate. Alright. So how is artificial insemination performed? It is performed by collecting the semen from the husband or the healthy donor, and then it is artificially introduced into the vagina or uterus of the female. Right. Make sure that you learn all the abbreviations and expansions mentioned in this chapter, as these are frequently asked questions. With this video, we've come to the end of the chapter Reproductive Health. This was part 2, where we've learned about sexually transmitted diseases, infertility, and 4 different assisted reproductive technologies. If you found this helpful, please do like the video, and if you have any doubts, comment down below. Subscribe to watch the upcoming videos. Thank you for watching.